The use of mobile clinics can be helpful to those who don't always have access to quality health care. Cone Health uses them all across the Triad, including right here in Greensboro. Once again, Sydney Moore tells us a story of a man who says that it greatly improved his health.
Our parks and recreation system is great.
Barry Jones enjoys living in Greensboro. It's where he's lived all his life.
But I actually live in the southeast part of town now.
As a native, he's watched the city evolve over the years in good and challenging ways, specifically where he resides near Freeman Mill Square.
When I was a kid, this was a very self-sufficient African-American community, but through revitalization, so to speak, that was taken away. We saw the mall come in, so that moved a lot of the businesses away from this community. And in places that drugs and violence came in.
He feels like the area became a desert for many things like food and access to health care.
I've noticed a lack, but I've noticed an effort to address it. But I think one of the problems is our community, we don't have health insurance.
Jones has chronic high blood pressure. At one point in his life, it was considered critical.
I did not have primary care. So therefore, if you don't have primary care, you can't get a 30-day prescription renewed time after time like you need to do with chronic disease.
In urgent need for care, he was referred to visit Cone Health's mobile clinic that was parked right near his home.
My lifesaver. When I came here, that was my goal, was to get a healthcare provider to write the prescriptions.
And he did just that.
So just need you to fill out the registration form.
Well, it's a walk-up only. They may need to have their blood pressure medication bridged until they get to see their doctor, or they may just have not seen anybody for their health care in several years.
Physician assistant Carrie Mayers helped assist Jones. She says scheduling to see a primary doctor can be difficult due to an influx of patients. Mobile clinics help alleviate that issue.
We do get to spend more time with a patient based on how many people are waiting to be seen.
I had heart exams through other providers that did not find what she found just with a stethoscope. So, you know, that really threw me for a loop right there, and it got the ball rolling on me trying to get into better health.
Thanks to a correct diagnosis, medication to manage the disease, and easy access,
I call this my public service announcement to my community.
Jones uses his voice to encourage others to take advantage of mobile clinics that help steer his health in the right direction.
Here's the question. When's the last time you looked in your medicine cabinet? I mean, really looked through it. Odds are it's been a while. Old medications can be ineffective. They can be harmful. So now is a good time to take a look and throw out those old medications and see what you need to restock before you need them again. It's also a good time to get rid of medications you're no longer taking, including medicine that was prescribed for maybe a temporary period.
It is critical that people don't take expired medications. And that's for a couple reasons, really. One of the reasons is because over time, medications can weaken. And so while that may not seem like a big deal, if you're taking something that's just not going to be as effective for you, then really you're just delaying treatment. This can actually worsen the problem. So then you have a bigger issue than you even started with.
Well, if you're getting rid of medicines, you're going to want to make sure that you're doing it properly. You can't just flush medications or throw them away to dispose of them. Placing prescriptions in a designated drop box, for instance, keeps medications out of our water supply and out of the hands of people who retrieve them from trash to sell on the street or to use themselves. Turning them into a drop box, pretty simple. You just remove the personal information from the pill containers, seal them in a baggie, and turn them into the drop box. Needles and syringes, though, cannot be returned to these drop boxes. You're going to want to contact Sharps to learn how and where to dispose of them.